Gloria Strode, and welcome to Straightforward. Today we are visiting with our great community friend and partner, Dr. Barry Poyner. The NARCAN guy, superhero. You're out in the community saving lives, trying to educate and inform the community on how important it is that everyone have NARCAN in their homes,
Yes.
businesses, churches.
Yes.
We're giving it to churches because we don't know what we don't know. And so you are out and about, and this is your, what, second
This
year?
is the second year. This is a 4-year government grant that's a partnership with SAMHSA. They may be changing that name.
Okay, so SAMHSA is government funding.
Yes.
Right, it's not state or local.
Right.
It's a federal government grant. Now, I want people to know that a lot of these community resources are federal dollars.
That's right.
It's their tax dollars at work.
That's right.
And this is a good grant program.
Yes.
So this is your second year. So last year you gave away how many?
We gave away around 4,000 units last year.
Uh-huh.
And
So what's your bragging rights, Dr. P? Since you're going to be the NARCAN hero, we're going to give you, your street name is Dr. P.
Yes.
Okay. With your cape.
The NARCAN man.
The NARCAN man.
And so this year we more than doubled that, over 10,000.
Really?
I'm putting together our quarterly report, and then it turns into a year because our year actually starts October 1st.
Right, that's federal funding year.
Yes.
It's the fiscal year, not the calendar year.
And I should point out that it's also a partnership with Columbus Consolidated Government, and really the brainchild of Dana Solomon.
Oh, the brilliant grant writer.
Yes.
Yes.
And an extension of drug court and Judge Gottfried.
Right.
And so I really feel like we have more than just a group of us working together. We're a team.
Oh, absolutely. And an amazing team. And you all did receive recognition at the state level for being a model drug court. And so the team is just phenomenal. You all work nonstop. In addition to everything that happens at the government center with all of the counseling and all of the court activities, you're in the community.
Yes.
You're everywhere, on both sides of the Chattahoochee.
That's true because our grant actually goes to really the Columbus Consolidated area.
Right.
The
Chattahoochee Valley.
The statistical metropolitan area
Right.
is a better way of putting it.
Uh-huh.
And that really is about 8 counties. So 6 on the Georgia side, 2 really on the Russell and Lee on the other side.
Oh, okay. So I didn't know we had Russell and Lee.
Yes.
So Lee is all the way out to Auburn.
It could
and,
go,
and
yes.
Opelika.
Yes.
Yes.
That's true. Now, depending on the maps, the way you look at it, Lee could be included there.
Right.
And so then the interesting point, though, here too, is that Taylor County is in the judicial circuit, but it's not in that statistical area.
Right.
But anybody that comes to...
Whosoever will.
I don't turn anybody away.
Exactly.
We reach out, and particularly we have a lot of events down at the Convention Trade Center.
Yes.
And so a lot of people across the state come.
Right.
Across states, even Alabama, come
Right.
to those events, and we give the NARCAN.
Right, because it's the taxpayers'
Yes.
money at work.
That's right.
For a worthy cause.
That's right.
And you're actually even providing for our military.
That's true. Yes, we work with the Army Substance Abuse Program.
Okay.
The ASAP program, and some great people there, and any of their events they invite me to, and we have a great relationship. And you know, this is the thing, you find the same caring people wherever you go.
I tell people, you know who the real people are that's in the community working.
Right.
Whatever the event,
Yes.
when you get there and set up, your paths will cross.
Yes.
And that's how you build community friendships, collaborations, and relationships. Yeah. And so you and Tabitha Moss,
Yes.
you all are all over the map. And when you go and visit the other counties, who are you visiting? So are we giving this to schools? Because I know you've done schools.
Yes. Well, as we mentioned, we have 6 counties in Georgia.
Right.
And really, if you think about it, those counties, if something happens, they're going to be coming to the hospital, you know, likely Columbus.
Right.
And so we're talking maybe 40 minutes or so before
Right.
they can even, you know, maybe longer than that before they get to the hospital. Once
Right.
something gets there and takes
Right,
them
because that's rural
Yes.
communities, and so there are no hospitals in some of those
There you
areas
go.
outside of Americas.
So to help me remember things, I like acronyms.
No, that's okay.
And so I talk about my chums.
Right.
And so we got Chattahoochee and
Okay.
Paris, and then we got, of course, Muskogee,
Right.
and then Marion down
Right.
at Buena Vista.
Right.
And then we have the T for Talbot. I think you know that
Right,
area
yeah,
well.
yeah, I know that area well.
And then also Stewart.
Okay,
And so it was Taylor's outside of that, but it's in our judicial
so
circuit.
circuit, right.
So, but again, when I go to those entities, I try to meet the local politicians and
Okay.
the volunteer fire department. Let me tell you, a volunteer fire department
Go ahead.
may not have this. And if they do have it, they're going to be using it sparingly because we're talking about, this is the NARCAN nasal spray.
Right,
Some of those entities do have the injectable type,
right.
but
But this is, anybody can use this.
Anybody can use
Because
that.
this is like, show them how
Yes,
this
yes.
is like what you use for allergies.
yes.
Right,
Now, I have to be a little careful when I say that because sometimes people, if they're just coming by my booth,
Right.
they think that I'm trying to give them a product to help them with congestion,
Right.
or help them with
Right, hay fever.
allergies.
We're
I
not
said-
doing that.
I said, no, this will help you wake up.
Up.
But this is what we would use, and I said, keep it with your first aid kits.
Okay.
This is what you would do when there is distress.
okay. So when we're going to the counties, we are giving this away for free.
Yes.
To schools,
Yes.
churches, businesses, outside of the first responders.
Right.
So,
because I go to them as well.
oh yeah, we know that because
Yes.
that's a part of the
Right.
grant requirement. But I just want the community to know, and I know that you have worked community events
Yes.
with our amazing friend Angela, AP, the Midday Diva,
yes.
football games, and you had a hard time trying to convince people, John Q. Public, that you need this in your home.
Yes.
Everyone needs this in their home.
That's it. Now, one thing
It's just like having alcohol, or in the old days, Mercurochrome or whatever that was, where we put
Yes.
that on everything,
Oh, yes, yes.
healed everything.
Yes,
Yeah.
it painted you up.
Yes,
as I
it did,
recall.
but it was a healer, right? So, but you, in the community events, you've had a hard time convincing people.
Well, there are. I actually declined an event. I don't decline very many events, but I declined, and I won't name names, but
Right.
I declined an event recently. They were going to have a focus on fentanyl.
Right,
And I said, oh, I'd be glad to come, but
Right.
it was associated with a school.
right,
And I said, but I want to be able to provide the NARCAN.
Right.
And some people are a little hesitant, and I was told the superintendent said we could have an informational booth, but we could not distribute NARCAN.
Really?
And so I simply said, I think I have a better place that I can go and give away the NARCAN, and so I respectfully decline. But I don't decline many.
Oh, I know that.
But there have been many schools that are proactive.
Right.
I'll give you two great examples. And, your listeners down at Chattahoochee,
Right.
the high school and middle school there,
Right.
we had a program there. Anybody who was interested was invited. School bus drivers
Right,
included.
sure.
They all came, got training, they got NARCAN.
See, and that's smart. But what we're going to do is put a pin there, go to our sponsors. We'll be right back. We'll be right back after word from some of our sponsors. Straightforward is brought to you by State Senator Ed Harbison, serving the citizens of Georgia's 15th Senatorial District and on the front lines for veterans every day. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road, trusted by generations. Whole Patient Healthcare. Dr. Jada Rimes-Bacote is board certified in family medicine. She believes the best patient care includes practical, individualized lifestyle changes. Located at 1338 13th Avenue, Columbus, 706-641-2080, or visit wholepatienthealthcare.com. The Framing Factory and Art Gallery for professional framing and decorative art, located in Lake Bottom, 1325 17th Street, or call 706-324-3823. And welcome back to Straightforward. I am really enjoying this visit with Dr. P. That's his street name now, with Angela, the Midday Diva, AP. So when we see you at the football game, the tailgate section with your cape on, make sure you put Dr. P, the NARCAN man, on that cape. But let's go back to the importance of this being into schools and colleges.
Yes.
You said the bus drivers came at a different county, which is important because kids are on the bus and they're transporting them. The cafeteria, the nutrition people, it's important that they have it. And being an old social worker, and then you work with children in your other life and community outreach, you wear so many hats. We don't know what we don't know about our teens, our children, and our family members. And of course, working in drug court, and you work with that team, and at every graduation, we hear how people hid their drug use from their family. So I just don't think it's wisdom to turn down something that's, if we are, here I go, if we can give out, and we have a line wrapped around the hall, and we're giving out ADHD medicine and all of that every day, we can have this at the school. Yes. That's Gloria Strode's opinion, and I'm going to stand on that. Right, because I witnessed that. They will be lined up at lunchtime waiting for the nurse to pass out the medication. This should be there as well. Right. This could save lives.
Well, and in fact, when high-powered opioids are being prescribed these days as a means of protecting themselves, usually your physicians and your drug companies are also giving prescriptions for NARCAN.
Oh, see, I didn't know that.
They're wanting to protect themselves, and because of all the lawsuits, that have come about because of the opioids. And so, but
and the opioids are prescription drugs for many people that get abused. We hear that in drug court, that they started with the prescription and then it wasn't enough and they moved to the street drugs.
Well, it's like any compound, as I tell people, or any chemical, you can overdose on H2O.
Yes.
And so the thing is that there are some legitimate great uses for pain medications, but we can get addicted or we can take too much accidentally.
Exactly.
And because, going back to the schools, because we live in multi-generational families, great grandmother drops one of her pills, and whatever, and grandbaby takes it accidentally or maybe takes it to school. Right. So when people say, well, we don't have to worry about this in elementary or whatever, I said, yes, you do.
You do.
You want to have, why not have something there to bring somebody back?
This is like having a fire extinguisher in your house.
It is.
It's like in case of an emergency.
I was at an event at Buena Vista down in Marion County recently, and one EMT came up to me and he says, this is now the protocol if we find particularly an elderly person unresponsive. He says, because so many elderly people are on high-powered opioids, at painkillers. We're not talking about illicit drugs. Let me tell you, if you run out of your painkillers, you're going to get satisfaction or help somewhere. It may be a pill that I borrow, who knows where it came from and what's on it, and that's when people really are in trouble. So he says, this is the protocol. We use this. So one thing that we did is, I thought, well, I need to go to Housing Authority.
Yes, you do.
So I went to Muskogee County Housing Authority, and they have units throughout, 20 if I recall correctly, in different counties as well. And we now have provided NARCAN for their staff there, and for health checks. You know, if somebody...
Especially elderly people living alone, and I have to say this, some of them having memory loss. I have some days being distracted, can't even remember if I took my medicine. Then I go back into the kitchen and I'll say, if I see where the cup is, then I knew that I took it. So sometimes we have elderly people living alone and they took the medicine and they didn't remember they took the medicine, so they take it again. This saved lives. And it's not about your ego or anyone insulting you. And I know you had that experience at one of the football classics last year. And you and Angela, you were set up with 98.3 The Beat, and you were all trying to convince some of the attendees, and the first thing, they were offended because they think, well, I'm not a drug addict. That's not what you're saying.
One thing I do probably need to do, now this is where I need your brainstorming, because you're great on this, is that many times at athletic events, because of safety protocols and so forth, they don't let them bring in bags. I think people were sometimes hesitant to take something because then they were encumbered for the rest of the game.
They would have to carry it.
So I need to think about it and maybe putting it in like a little, like a little bag or something.
And it would need to be a clear. Like we could put, like they do Halloween candy, which I don't give out Halloween candy because they'll know a Bible verse, they won't get no candy at my house. But anyway, put it in a clear bag and like this, and then draw it. So then they can put it on their wrist. So maybe we can find some of those online or something like that.
Well,
So
you
we'll
saw-
search for that.
Oh, talking about candy makes me think with the holiday upon us and so forth, and going back to kids or whatever. You know, it's not a myth when we talk about Skittles parties or whatever,
Right.
and kids will just mix up the drugs and then at random. And so
Right.
where are they getting them? Well, from
Right.
grandma's or your own drug cabinets. When the kids come over, you know, to
Right.
visit your home and
Right.
use the bathroom, you think they're not looking in your medicine cabinet?
Sure, even the grown people.
Oh,
I know
yes.
people that ramble through people's house and things like that. I never do that.
Right.
Even if I spend
Right.
the night at your house, I'm never going to open your drawer. I mean, that's just my psychology, but everybody's not like that.
That's right.
Right.
And so again, we're going back to this idea of realizing that this is more pervasive than we might think, and that it can happen.
Sure it can.
We think it can't happen. I want us to go back, Gloria, if you would, to this sheet, because NARCAN here is a sticker that you can put anywhere, really. When I was in, recently, Lumpkin, the sheriff there put it on his door because now he had, this was the police chief at Lumpkin. He said, now I have NARCAN, and he put it on his door.
Right.
But you can put these on your AED boxes, and many
Right.
places, many entities, churches included, have the AEDs to bring somebody
Or your
back.
regular first aid kit.
Yes, but with the AED boxes, they're in many public places.
Right.
And so, for instance, Russell County contacted me, David Martin, as I recall, and David said, I just got a grant for 300 AED boxes. I said, well, let's put NARCAN in them. He said, well, Barry, I need something to identify that NARCAN's in there. So we went to our company, got those stickers for free. They were
For free.
glad to do this.
Exactly.
And so we stuck them on, and so now all of those AED boxes in Russell County,
Okay.
300, have a box of NARCAN in them.
Okay, and see, that's important. Our churches, I tell you people, whatever the community organization is, because you don't know what you don't know. And I tell you, if you ever attend a drug court graduation, that's what, the drug court, mental health court, and veterans court. And many of them have the dual diagnosis, so they might be a part of many of the courts.
Yes.
But I'm just saying, you don't know what you don't know. And if this could save the life of one of your loved ones, your neighbors, or someone like that, just let the false pride go, because this is life-saving. But what we're going to do is go to our break to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors. Columbus Pediatrics GA, working together to build lifelong relationships between our staff and patients by consistently providing compassion, excellence, and value with 2 locations. The Old Town office at 3580 Massey Lane, Suite F, 706-596-8667. The Midtown office, 1900 11th Avenue, Suite A, 706-323-3400, ColumbusPediatricsGA.com. Barbara's Cleaning Service, a 5-star commercial service with satisfied customers in Georgia and South Carolina, built on the principle that every detail matters. Barbara's Cleaning Service, a new season building a family legacy. The Miley Agency, Gerald Miley and his team can assist you in every aspect of your insurance needs. Call today for your free quote at 706-996-2045 or visit themiley.agency.com. New Horizons Behavioral Health, building better lives in the Chattahoochee Valley, providing services to persons with mental illness, developmental disabilities, and addictive diseases. Located in the Health and Human Services Building, 2100 Comer Avenue, Columbus, or call 706-596-5500. And welcome back to Straightforward. It is always a pleasure to be with the amazing Dr. Barry Poyner, street vernacular Dr. P, the NARCAN man. So you'll be seeing him throughout the community and doing great things as he's always doing. It is free, but we don't want people to call Dr. P to check the box. His role is to educate, inform, and do all he can. The NARCAN man saved lives. And that's really what it's all about. It is. And there is no age, race, or economic discrimination when it comes to overdose.
That's right.
And that can happen in any zip code. So never say never. Well, it could never happen. Never say never, because it could be accidental.
That's right. And the rates of overdose death have declined across the nation. but not necessarily proportionate to every demographic group.
Okay.
And so there are certain demographic groups, our African American friends, for instance.
African
And I think in
Americans?
part it's because they don't have ready access to
Narcan.
And so
But
that's-
you've put it in public housing.
Yes.
And there's many churches. So if your church, for all of the missionary organizations inside of the African American churches, those boards of Christian education,
Yes.
all of those boards, you all need to have this ensured that it's in the church.
Right.
So we're not going to wait on the leaderships, the deacons, the stewardess, the stewards, whosoever will. If you are a functioning organization inside of a faith-based group in Muskogee County or the Chattahoochee Judicial Circuit or the Chattahoochee Valley, because he will give them to you because these are your tax dollars at work. Now, I said that, I'm standing on that. No, really, because sometimes people don't want to overstep whoever is in charge. Well, sometimes you got to ask for forgiveness and not for permission. I just said that. So, I'm an old social worker, and so you have to be resourceful.
Right.
So it's about the community and saving lives. So you got some great stuff going on, and I just love these. I tell you, I just get so excited when y'all give those out.
Well, these are challenge coins, and this was a great idea that really came from Dana Solomon and also Tony Newton, in the sense of the challenge coins in the military community are very well known, and they said, this might be a great incentive to help our first responders, but even our community partners, anybody that I've given Narcan to help them realize that if they report back that they used it, whether it saved somebody's life or not, whether
Right.
they used it, that way we gain that information and
Right.
learn that we've helped someone, and it helps with our governmental reporting.
Exactly. You can measure the success of the program.
Yes. And so it's a bit of a carrot, if you will. But
Okay.
the reason it is people get busy. And so as they save somebody's life, it's one more step to do, but it's a meaningful step. And so I say, well, listen, you use it and report back, we will replenish your Narcan. But I'm so generous there. So that I don't know has been a great incentive.
Right.
But the other is that let's reward you with a challenge coin.
Right.
And so, for instance, I just did my quarterly report here. For the year, I know at least 24 people that we saved.
Really?
That we brought back. At least 24. But I
And
know
they had overdose. So when you say brought back, I want our viewers to know these were people that had overdosed.
overdosed.
And we were able to use this Narcan. Let's hold this up. Let them see it.
Yes.
That is a little nasal spray like we used to have for Vicks nose drops and all that old school. And so you were 20, how many? 24. Okay.
And so that is underreported, I know, because there are many entities that use it and don't report back to me.
Right.
But we know at least that many. And so that's gratifying, but it also goes into our data collection. We're not all about numbers. We're about really people.
But you got to prove that this is
do.
working, that the federal dollars, the taxpayers' money is not just being wasted. Because some people don't understand. They think every federal program is a waste. That is not true. This is your federal dollars at work, and right now, documented, we saved 24 lives, but we know it's greater than that, because some people never will tell.
That's true.
That.
That's true. And so, but we want to get people into treatment.
Right.
But we're giving them another chance at life.
Right.
Is the idea. And so, again, the training, see, people are hesitant sometimes to take because they're fearful about training.
Right.
So we will provide training for you, and that's free as well. And we have a pre-test. I talk about that being the front
Lord.
porch. This is the P.O.R.C.H
Project.
providing overdose reversal to give Columbus hope.
Okay.
And so the front porch is my pre-test, and then if you learn something, we have to have a post-test, and of course I call that back porch.
The back porch. So the pre-test is the front porch,
Yes.
and the post-test is the back porch after they've gone through the
Yes.
training.
And we try to make it,
Okay.
I try to, and I learn every time I go to a group. I was recently with a group, and this one nurse came up to me, and she says, Barry, I worked in the ER for a while. She says, it's amazing what you learn. And I said, yes, and you're teaching me. She says, we had two college age that had come in, two young ladies, and they had overdosed. They had Narcan, but they had taken the Narcan beforehand.
What?
In a sense of thinking that that would ward off and that they wouldn't have to worry with. And so this is why, when I do go with high schools and so forth, I don't give the Narcan. I want to make clear about this. I don't give this to minors, even though this is not a prescription med.
Right.
I don't give it to minors because of maybe misunderstanding.
Right.
But I'll give it to teachers and adults, the grandparents,
Right.
the parents, and so
Exactly.
forth, the caregivers.
Right. Or the guardians.
Guardians, so that they understand, what's being there. And even college campuses. I was recently on at Columbus State. In fact, I'm going this week to do some more training there. But they had not had a general giveaway of Narcan until recently, and I participated in that event. But what really touched me, throughout their commons ground, they had photographs of loved ones who had succumbed, who had died.
Who had overdosed from drugs.
And I had 2 mothers and a sister of one of these to come up to me, and we talked. And I wanted to know more about their loved one. But sometimes we don't bring this home and make it personal.
Yes.
That is, and I thought, oh, how tragic, but also moving. We're seeing all of those pictures.
Yeah, and it's like we have to do something. So tell people where they can find you. This is a free service provided through a SAMHSA grant, which is a federal government grant, and it is being managed out of drug court with Dr. P and the amazing Dana Solomon.
We're on the 5th floor of the Government Tower building, which is on 10th Street there in Columbus. And so you can do a Google search easy enough to find the P.O.R.C.H project, Columbus, Georgia, and that will take you to our website.
Okay.
And you can email me there. There are also, our phone number is there. We can provide that maybe for you to scroll down to the bottom. And
Right.
My work
That it'll
cell,
show.
yes, is 706-905-7945. I got to double check myself. And so I'm not giving out my personal cell,
Right.
but that's my work cell, and I'd be glad to work with you.
All right. Well, I thank you for all that you're doing, you and Tabitha and the team. You all are amazing. Thank you for saving lives and restoring families.
Yes.
We'll do it again.
Yes, ma'am.
All right. This has been Straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.
What up, world? What's up, Columbus? Be sure to tune in every Sunday, Straightforward with Gloria Strode, right here on NBC 38.